I'm Dr. Jonas Bromberg, and I'm a clinical psychologist. I've worked with children and families for over 20 years in a variety of clinic, hospital, and school-based settings. And I've helped these children and families with a variety of behavioral disorders, including ADHD. ADHD is diagnosed by bringing together information from three different sources. The doctor that's making the diagnosis will gather some information from observation and interview during a clinical appointment. Another piece of information is then gathered from a parent outside of that clinical encounter, and that's usually done by asking a parent to complete some sort of structured rating form about the child's behavior. In the same way that the parent completes those ratings, the doctor will usually ask the parent to have one of the child's teachers, or in some cases more than one of the child's teachers, to complete that same information. So the doctor then brings together those three pieces of information to make the diagnosis. The doctor, the parent, and the teacher make up what I refer to as the triangle of care. And in order to make a good diagnosis, communication is really critical, and it needs to flow around that triangle of care in an optimal way. The doctor needs to have that information in a consistent and organized way to help them look at that information not only at the time of diagnosis, but over time, especially when a medication is prescribed. The guidelines for treating ADHD call for that same information to be gathered periodically so that the doctor can look at the effectiveness and whether the medication that's prescribed is having the desired effect on the child's behavior. Without that information in an organized and consistent way, the doctor doing the diagnosis or managing the treatment is really flying blind. So it's very important that parents become active in the process and use the tools in the toolkit we have to help ensure that good flow of communication. On the InsideADHD website, we have a toolkit, and the goal of that toolkit is really to improve the overall quality of care, with an important piece of that being the communication. A couple of examples of that: in the toolkit, we have a classroom behavior log, which is a structured way for a child's classroom teacher to make some observations, take some notes, and be able to report information to the parent and the pediatrician about the child's behavior in school. Another tool we have is called the medication log, and that's a way for a parent to report to the pediatrician on the effectiveness of the medication. So it helps the parent track, take notes, observe in an organized way things like the response to medication, side effects, and any other notes they might want to make that might be important for the prescribing doctor to know. Doing that in an organized way helps improve the quality of communication, improve the quality of the information that the doctor has, and helps them be more effective in managing the care. The toolkit's available on the InsideADHD website. It can be downloaded free. All the tools there to help a parent really manage and organize the whole process of getting their child diagnosed and ushering them through treatment.